I welcome you all to our channel Wishtpost. First of all, I would like to thank Dr. Navdeep Sharma sir for giving me this opportunity to talk about hepatitis, its causes, symptoms and its effects on different body organs. First of all, we'll see what is hepatitis. Hepatitis is basically inflammation of liver tissues. It can be distributed into two parts: acute hepatitis and chronic hepatitis. Acute hepatitis is that hepatitis which resolves on its own within 6 months, and if the symptoms does not resolve or it prolonged 6 months, then it is called chronic hepatitis. First, we'll see acute hepatitis. Acute hepatitis can be distributed into 3 phases. First one is prodromal phase. Prodromal phase, there are symptoms like fatigueness, generalized weakness, anorexia, decreased appetite, joint pains, fever and headache. Then the second phase. In second phase, there is yellow discoloration of skin and eyes, and it happens mainly between 2 weeks and 4 weeks. In 20 to 30% of people, enlarged spleen could also be found. It can also cause liver enlargement in some patients, and those patients suffer from right abdominal pain, upper right abdominal pain and discomfort. Then third one is recovery phase. In recovery phase, all the symptoms that I have mentioned earlier will resolve on its own. Now we'll see chronic hepatitis. If all the symptoms prolong beyond 6 months, then it is called chronic hepatitis, and it can also lead to liver cirrhosis, liver abscess, liver cancer and liver failure. It can also affect hormonal functions of the body and cause acne and amenorrhea. Now we'll see the causes of hepatitis. The first one is infectious. Infectious hepatitis can be distributed like hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E. Hepatitis A is mainly found where there is poor sanitary conditions or poor hygienic conditions, and these are mainly found in developing countries like India. So it transmits through fecal-oral route. Now the second thing is hepatitis B, hepatitis C and hepatitis D. When the blood and mucous membrane of a person comes in contact with the blood and mucous membrane of an infected person, then there is a possibility of transmission of these hepatitis. These viral particles are also found in semen, vaginal secretions, breast milk, and the illegal intravenous drug users also suffer from these hepatitis B, C and D infection. Now we'll see hepatitis D. Hepatitis D, it always coexists with hepatitis B because it is a defective virus that requires hepatitis B to replicate. So this condition is more dangerous because there is coexistence of 2 hepatitis, that is B and D. The important thing to note here is vaccination for hepatitis C is not available. Next is hepatitis E. If a mother is suffering from hepatitis E, then there is 20 to 30% more chances of mortality rate. It happens mostly in 3rd trimester and it is most commonly found in developing countries. Now we will see another cause, that is parasitic hepatitis. Various parasites like Leishmania, malaria, Plasmodium species, they cause liver inflammation and increased our serum IgE levels, which leads to parasitic hepatitis. Next is bacteria. Various bacteria like Mycobacterium species, Salmonella, Brucella species, they also cause liver inflammation, pyogenic abscess and liver abscess. Next is alcoholic hepatitis. When a person consumes alcohol more than a limit, then more than a certain limit, then they are at higher risk of alcoholic hepatitis. Like in men, if they are consuming alcohol more than 80 grams per day, and women, if they are consuming alcohol more than 40 grams per day, they are at risk of alcoholic hepatitis. Next is toxic and drug-induced hepatitis. Some chemical agents, industrial toxins, and herbal and dietary supplements can also cause toxic and drug-induced hepatitis. Next is autoimmune hepatitis. When the immune system of our body mistakenly attacks liver cells of our body, then it causes autoimmune hepatitis. Now let's see according to Ayurveda. According to Ayurveda, liver is known as Yakrit. Yam means activity, Krit means digestion, and in modern medicines also, liver is responsible for absorption, metabolism, and digestion. So, in Ayurveda, excess production of pitta leads to various liver diseases. It can also be correlated with Kamla. Kamla is Kaman Lati iti Kamla. Kaman means Ichha, desire. Lati means to diminish. The person who loses interest in all aspects is suffering from disease Kamla, which can be correlated with jaundice according to its symptoms. It can be related with obstructive jaundice, which in Ayurveda we call Shakha Ashrit Kamla, and Bahupittaj Kamla, which can be correlated with hemolytic jaundice. In hemolytic jaundice, there is excessive production of bilirubin because of excessive breakdown of hemoglobin. Now we'll see effects of hepatitis on our body parts. According to WHO, approximately 70 million people worldwide are affected from hepatitis, and it can lead to symptoms throughout our body. And living with this condition for a longer time can make our body vulnerable to serious complications like liver failure. Now first we'll see how it affects our brain. The toxins produced during liver inflammation can affect our central nervous system and can lead to various symptoms like slurred speech, and if not treated on time, it can also cause unconsciousness. Then next is how hepatitis infection affects our endocrinal system and immune system. HCV infection can mistakenly attack our tissue like our thyroid cells, and it can cause overproduction of thyroid that we call hyperthyroidism and underproduction of thyroid which we call hypothyroidism. In hypothyroidism, the symptoms are like fatigueness and weight gain. In hyperthyroidism, symptoms exist like weight loss and sleep disorders. In hepatitis infection, there is it affects our central nervous system and cause a musty disorder or sweet odor in our breath and mouth. Then unhealthy blood. A poorly functioning liver cannot produce much needed components which is required for the proper functioning of spleen, and it causes anemia. Then how it affects our intestine. It hinders intestine ability to absorb nutrients and minerals which we eat. Next we'll see how it affects our bladder and bowel movements. Because liver is inflamed and toxic materials are produced, it affects our bladder and bowel movements, and the body intestines are not able to eliminate waste products, because of which there is abnormally dark colored urine or clay colored stool. Next is how it affects stomach. If the liver does not produce enough enzyme, the protein albumin, the fluid can build up in the abdomen, which we call ascites, which can cause upper abdominal discomfort and pain. Hepatitis can cause hair loss, dry skin, and poor knees. This may be because of nutritional difficulties. Now we will see how it affects our circulatory system. In addition to filtering toxins, liver is also responsible for the formation of components needed for proper flow of blood and blood clotting. If inflamed liver is not able to produce the proteins which is needed for proper flow and clotting of blood, it can increase pressure in the portal veins of the and it can also cause massive internal bleeding, which we call varicose bleeding. I hope all this information is very important, is valuable for you, and please do subscribe our channel West Coast. Thank you so much.